On Friday, we identified 154 new cases, and the provincial lab completed almost 11,400 tests. On Saturday, we identified 171 new cases and conducted more than 11,300 tests. For Sunday, we identified 137 new cases. On that day, more than 12,000 tests were completed. Finally, yesterday, we detected 157 new cases and conducted 12,561 tests, a new daily record for Alberta. Sadly, I must report 5 more deaths over the long weekend. This includes 2 residents of the Good Samaritan Southgate Care Centre. These residents had improved and were considered to have recovered, but their conditions then worsened and sadly they passed away. My sympathies go out to all who lost loved ones over the weekend, whether to COVID-19 or any other cause. I am pleased to report that more than 13,100 Albertans have now recovered. However, 45 people are now in hospital, including 10 in intensive care. There are currently 1,692 active cases in the province, unfortunately the most we have had since May 9th. I am concerned about the continued rise in cases. Our focus continues to be on limiting the spread of COVID-19 in the community and responding quickly to outbreaks when they occur. However, higher case numbers and more outbreaks can strain our frontline teams. We have posted new outbreaks today, including one at the Fairmont Hotel Macdonald in Edmonton. Currently, there are 7 cases linked to this outbreak. The cases are all among staff members, and Alberta Health Services is working closely with the hotel to ensure anyone at risk is isolated and tested as needed. At this time, no risk has been identified to hotel guests. As many of you know, a number of cases in school staff and students were among those reported this weekend. As I mentioned on Friday, this is not unexpected. In each case, AHS worked quickly with school officials to identify contacts and ensure anyone at risk is isolated. This quick action is crucial to keeping schools safe in the days and weeks ahead. I also know that getting told you have tested positive or are a close contact can be upsetting for these children and their parents. It is important that we talk to our children about what this means and what will come next. If your child is a close contact, they will need to isolate for 14 days. Testing can be arranged, though they will need to stay home for the full 14 days, even if they test negative. I know that it can be frustrating, after just a few days in school, that they already may need to stay home for 2 weeks if they are a close contact. This is understandable to be frustrated. At the same time, we need to approach these situations cautiously. Anyone exposed to COVID-19 could become ill at any point in the next 2 weeks, and a single negative test does not assure safety. As we gain more direct experience with COVID-19 in schools, we will continue evaluating our approach to assessing close contacts. At this point, all students in a classroom are considered close contacts if a classmate attended while infectious. We will assess that, as I said, and over time perhaps be able to adjust and amend that cautious approach. I also want to put these cases in context. All school authorities have returned to school as of today. In a normal year, this would mean about 750,000 students and 90,000 staff in 2,400 schools across Alberta. While not all students have returned due to some families choosing at-home learning options, the majority are back in class. Since September 1st, Alberta Health Services has reported to us 11 cases that were present at 11 different schools while infectious. This leaves approximately 2,389 schools who have had no disruption. None of these 11 cases acquired infection at school. Alberta Health Services is responding, and we are taking each case extremely seriously. But we also need to remember that there are no risk-free options with COVID, and that we must support every aspect of our children's health. We need to be nimble and continue adapting our approaches based on emerging evidence and the needs of schools and students. For example, as noted in Order 33, masking is mandatory for grades 4 through 12 outside of seated class instruction. However, we are allowing schools to implement enhanced physical distancing measures as an alternative to mandatory masking if a school can make sure that 2 meters is maintained at all times outside of seated class instruction. If this can be done, and if a school authority can submit a detailed plan showing how this distancing will be maintained, some schools may be allowed to not require masking indoors in the school. The Fort Vermilion School Division submitted such a plan last week for 6 of their schools, and I approved it yesterday. It includes aggressive measures, such as allowing only one cohort in a hallway at a time, staggering class transitions, and eliminating school transition times. We will be following up to ensure that the plan is working as intended and that there is no risk to the students. We will also continue to closely monitor the spread of virus in schools and adjust as needed to meet local needs. If needed, we will make adjustments to our school models in all locations in Alberta in the weeks ahead. We have committed to being as transparent as possible with Albertans. We are developing additional online reporting tools to help keep the public better informed on school cases and outbreaks, and I look forward to sharing these with you in the very near future. I know that this is a stressful time for many. I've heard that returning to in-person or online learning has brought familiar comfort to some families and added stress for others. As parents, we need to help educate our children on the public health guidance for back to school, including being masked and following physical distancing rules. Particularly critically, every day, we need to ensure our children are healthy and keep them home if they are unwell, even if they are only feeling slightly unwell. I have also been told that many students, especially older students, have been congregating after school, sharing drinks and in close contact with each other without masks. Even if schools operate perfectly, there is a responsibility for parents and students to make sure that the same precautions are followed outside of the school. I recognize that a lot of information is coming quickly from teachers, schools, and from public health workers. It is a lot to take in and can certainly add to the stress. That's one of the reasons I have written an open letter to all parents in the province. This letter includes information on public health guidance for schools, clarification on masks and physical distancing, suggestions for preparing your child for in-school learning, and more. The letter has been shared with school authorities, and parents should receive written copies shortly. I'll also post it online and via social media later today. From my perspective, the reality of the situation is that we do have slowly increasing community transmission, and that with slowly increasing community transmission, there is a higher likelihood that we will see cases in schools. With the cases that we've seen so far in schools, and even if the 11 that I've been informed about by Alberta Health Services, if there are others under investigation that will even double that number, that's still the vast minority of school settings in the province. We have known that with opening schools in person, it was absolutely expected that there would be infectious cases in schools because there are infectious cases in our communities. Again, that's not surprising. And it's too early to say whether or not the current school model will be sufficient to protect against all transmission. I expect we will have some low levels of transmission. And I've been very clear in the last few weeks that returning children to school in person cannot guarantee a zero COVID risk, and that each family must make those decisions for themselves because each family has a different set of circumstances that will make COVID-19 exposure more or less risky for them. And so some families have, of course, chosen to go with remote learning. Others have chosen to send their children back to school. And the reality is that we have to learn to live with COVID, and we have to learn to balance the risks of occasional exposures with the risks of keeping our children home, keeping our children out of school in person, which has other long-term risks for their health and well-being. So again, that's the long answer. The short answer in my perspective is that the current situation is not unexpected. It's too early to be able to give an evaluation of our school model. We will be watching closely. And if our community transmission continues to rise, we may need to look at other models in certain high transmission areas. But we want to make sure we're giving every opportunity for students to have a successful return to school with everything we can provide in this model before we accept some of the risks that would come with any alternate model.